episode of this great adventure that myself, Raul, and my co-host Robert Asencio have been involved with for a while now, maybe going on a month. And we're growing and enjoying the community support. We have our sponsors to mention, Miami Tactical, Mainland Marlins Podcast with our producer, Tommy. Mainland Marlins Podcast, Share Your Heart, and New Era Alliances. We have a guest that supports our community, law enforcement. And Robert, you want to introduce our guest?
Absolutely. I've had a great pleasure meeting this young lady who provides an incredible service to law enforcement and first responders as a whole. She has created or been part of creation of an expansion of a mail order pharmacist that provides medical prescription care to first responders on a monthly, timely basis, hassle-free. And I wanted her to come on and introduce herself and her company. And without further ado, this is Dianna Parrish, principal of First Responders Pharmacist. We have that audio problem, but go ahead and speak, Dianna, and introduce yourself so that we can no longer deal with that problem.
All right. Can you all hear me?
Yes.
Okay.
Yeah, so I am both a patient advocate and a principal for First Responders Pharmacy. We are a mail order pharmacy. We're in the space of workers' compensation, and we provide prescription medication for first responders throughout the state of Florida. A little bit about me. I was a workers' compensation and Social Security disability attorney for 22 years. Most of my career was spent with my father, David Parrish, Parrish Law Group. And I only serve this pharmacy and this first responder community. I was a litigator for first responders, always on the first responder side and the injured worker side, helping injured workers and first responders obtain Social Security benefits and workers' compensation benefits. And now I work as a patient advocate for this pharmacy. We provide medication for firefighters, police officers, corrections officers, EMTs, like I said, throughout the state. And all these patients are all on workers' compensation, or they're trying to get onto workers' compensation. Some of our patients are in litigation with the workers' comp carriers, and we support them and we work as advocates on their behalf. Some of our first responders are a very unique community, and I'm sure you all know this. As a part of the Florida statute, they have their own portion of the Florida statute under workers' compensation that is only for them. And so they get extra benefits that the rest of the injured worker community does not get. So a lot of our patients, I would say 80% of our patients are on the heart-lung bill and are receiving heart medications as a result of that condition. A lot of our patients are suffering from PTSD and mental nervous injuries, and they're receiving medications for that. We have orthopedic injury to take care of, heart, and some orthopedic neurological conditions. And this year, I would say we have a huge portion of first responders that have come in with COVID-related conditions. And so that's been very interesting for us to kind of navigate that illness and the aftermath of that illness. So that's what we do, and that's what I do. Like I said, we are a mail order. We like to provide prescriptions on a 90-day basis. We have relationships with all of the doctors that are in this space. We know all the cardiologists in the state of Florida and have relationships with them, because the cardiologists see patients that we see. We maintain a relationship with the attorneys that represent the injured workers and the first responders. We maintain relationships with the insurance carriers, the adjusters, the nurse case manager, with union representatives, and we are very patient oriented and patient friendly. So that's kind of what we do.
Dan, thank you for being with us, and I want to thank you for the service that you're providing our first responding community with First Responders Pharmacy and the service that you perform for our first responders as a whole. I want to ask you a brief question, because I know COVID's been a big deal. We've had a lot of individuals die in South Florida. not because of criminal elements that have confronted them, but because of COVID. We've had a lot of first responders pass away because of COVID. And you mentioned PTSD and whatnot. I know our first responders are out there getting the vaccine now. And but can you give us because we talk about the tactical and the shooting and this and that, whatever. But now we're from a holistic approach, we're talking about how officers and first responders are taking care of themselves and having individuals like you help them to take care of themselves. Give us a brief, without giving out any details, how does it work? What would need to occur for someone? Because I know you're in the Maitland area up in Orlando, Central Florida. How would it work for someone to get involved with what you're doing as far as helping? And do you service the South Florida community?
The biggest community that we service is South Florida.
Okay.
And so and I can give you all, I know that Robert has a lot of our information, but I can give you my phone number, the pharmacy's phone number. As a patient advocate, I'm the first person that you're going to speak to. And so I will take all the referrals come this way. Most of our patients come to us because they cannot get a commercial insurance, a commercial pharmacy to fill a prescription. So for example, a patient will go to Dr. Gonzalez in Miami. A lot of patients are treating with Dr. Gonzalez in Miami because he is an authorized cardiologist in the workers' compensation arena. And Dr. Gonzalez will prescribe 4 or 5 prescriptions. That patient will go to Walgreens or CVS or some other pharmacy unless Dr. Gonzalez refers the patient to us. And when they get there, the commercial pharmacy, the Walgreens, will say, you know what, we can't reach your insurance adjuster. We can't reach your nurse case manager. We don't have authorization to fill rosuvastatin, Repatha, metoprolol, things like that. And so the patient will have to wait, and they'll call the workers' comp carrier and they'll attempt to get authorization for the medication. The commercial pharmacies will not fill those medications unless they have authorization from the insurance carrier. Because we're a boutique independent pharmacy and we only service first responders, we fill immediately. So if we get the prescription in our pharmacy today, and I can get the prescription by contacting Walgreens, contacting Dr. Gonzalez, or even the patient can send me the prescription, we will fill today. There is no waiting with us because we know that if the doctor is authorized and the workers' compensation carrier under the workers' compensation law in the state of Florida is required to pay for that medication. So I do not wait to speak to an insurance adjuster if the medication is coming from an authorized provider. Our pharmacy will immediately fill it and ship it. We use Federal Express. We can sometimes get it the day to the patient, the day we get the prescription. It's rarely more than a 24-hour turnaround between the time I get the prescription and the patient has the prescription in their house.
Wow, spectacular. So please give them the point of contacts for the officers to get a hold of you or First Responders Pharmacy.
So my contact is 407-897-9245. 407-897-9245. And really that would be the number that they would need to call. I would have to get a little bit of information from the patient and then I'll go to work. We'll contact the doctor that they're treating with. We'll get the prescriptions in the pharmacy. We'll fill the medication and we'll send it out. We keep all the regular first responders medications in stock. And when I say that, what I mean by that is first responders, like I previously alluded to, they all kind of have the same kind of conditions, the same kind of injuries. So a heart patient will have his own personal cocktail of medication. Robert has his own personal cocktail of heart meds that he takes. And so we keep those meds in our pharmacy so that we can get them out very, very quickly when we receive a prescription in the pharmacy.
So real quick,
listen, that's excellent information. That number again is 407-897-9245. For those that didn't get it, again, 407-897-9245. If you're a first responder in South Florida and want to reach out and get services from Dianna and First Responders Pharmacy.
Dianna, we're going to invite you to our next podcast because
Okay.
this audio problem that we're having is going to be interfering in the audio. I mean, with the audio of the video. So we want to make sure that we bring you on for a second, more longer conversation. We'll reach out to you,
Okay.
guys. For those of you viewing, remember, police work is a contact sport. Officers, we charge them to go down in there and protecting and community, providing law-abiding citizens a great community to live in, a safe space. But the officers often get injured. Dianna Parrish from First Responders Pharmacy is there to provide the help when the officers get injured, get them quickly healed up if that's the case, and get them back on the job. Or in those people, the cases that have the heart and lung bill, that is a lifelong condition, they are there to provide support. On that note, Raul, I think we're done.
We are. Thank you, Dan, for being with us, and we hope to be with you soon again and having a good conversation, because that was a lot of info, and I really appreciate what you're doing.
Thank you. Thank you. I would like to speak more about COVID because that's been a real hot topic this
It is.
year. Who's covered, who hasn't covered, and the medications that they're being prescribed.
So
We
let's
gotta-
do that on the next one.
Yeah, we got to do another show.
This week.
Absolutely.
This week. Thank you.
Thanks, guys.
Thank you, Dan.
That's it.
Bye.
We're pretty much done. So until the next episode, stay tuned and join.
Welcome again to another episode of Miami Cop Talk. Miami Cop Talk, one community, one voice. We want to thank our sponsors, Miami Tactical, Tactical again, Mainland Marlins, Share Your Heart, New Era Alliances, Tommy, our producer. We have a lot of people jumping on board and supporting our show. If I didn't mention your name, sorry. Call us, visit us at MiamiCopTalk.com. I'm here with my co-host, Robert Asencio, and we have a great guest. Officers spend a lot of time on their feet, walking the beat, and we have an excellent guest with us. Do you want to introduce our guest, Robert?
Absolutely. So again, it is also my honor to introduce Dr. Adriana Streambu. I may have mispronounced your name, and I will ask you if I did mispronounce it. My apologies. So better get the enunciation of the name. But this is a young lady who is a doctor, a podiatrist, specialty of the feet, something we very seldom really care for about. I mean, how many times in your 30 years of public service did you ever consider going to a foot doctor? Yet I'm sure you had a bunch of problems with your feet.
Absolutely. Your back pains, you're buying Dr. Scholl's, you're doing this, or you're changing your sneakers, boots, and whatnot. But we don't focus on what we stand on, our entire lives, which are our feet. Podiatry is a big deal. And I want to thank Dr. Adriana for being here. If you want to go ahead and give us a little bit about your background and share, I know you're with Miami Podiatry Association. Go ahead and speak to our audience and share a little bit about what you do and what you can do to help our first responder and community as a whole.
Okay, thank you so much for having me. First of all, Mr. Asencio, you did pronounce my name correctly. Thank you so much. So I am a podiatrist. I'm working at a clinic, my clinic in Hallandale, Florida, and I'm the president of the Miami-Dade Association. I also am involved with Florida State Podiatric Medical Association. I work with the public affairs. I'm the chair of public affairs there. So as podiatrists, we see that especially during the COVID pandemic now, a lot of people are ignoring their feet. And just as your health is important overall, your feet are just as important as your total health of the body. And a lot of times, like you guys said, people tend to forget about the feet, and especially a lot of diabetics who have problems, and we know that diabetics have a lot of complications due to infections from the feet. So ignoring your feet is not a good idea. And also for the officers over there who spend a long hours on their feet, it's important that they take care of their feet, wear the right shoes and all that. So if they have any pain, it's very important to visit the podiatrist. So, and there are things that I know people are concerned about COVID, to come into the office, not to come, but there are things that we can do through telemedicine, that you don't have to come into our office if you think that you don't want to risk your life, or you don't want to get COVID or concern. there are things that we can do through the telemedicine. And there are things that, yeah, we do recommend you must come into the office. So what are these things? Telemedicine is reserved for non-urgent care problems like arthritis or heel pain or something minor. And then if you have something more serious like a wound or redness, or you're a diabetic and you're concerned that you bumped your toe and did you have a fractured or anything like that, of course, those things we recommend that people come in the clinic. And if you come in the clinic, you don't have to be concerned, oh wow, would I be exposed to COVID? Because we take a lot of precautions when it comes to protect people during the pandemic right now, especially when we checking temperature before people come in the clinic. We perform a comprehensive screening through questionnaires. We wear masks. Also, our staff wears masks. We limit the time of the patient waiting in the waiting room. Also, we don't allow duplicate appointments. We try to keep patients in and out and not to have contact with each other. So we practice social distances. And we also do the deep cleaning between the patients. So you don't have to worry about that. So we take all these precautions.
So absolutely, let's not ignore our preventive care, right? And treatment of conditions. Doctor, real quick, because we have 4 minutes, and I want to make sure that we advertise. If anyone wants to get a hold of you, learn more about podiatry and the association, 2 points of contact: your point of contact and the associations, so they can find a doctor near them.
Okay, so my point of I'm Dr. Adriana Strambu. Our office phone number is 954-455-9404. My office address is 404 North Federal Highway in Hallandale, Florida. I have a website, which is hallandalebeachfooddoctor.com. You're welcome to check that out. We also invite you to visit our association website, www.fpma.org. Over there, we have a listing of all the podiatrists and how you can get in contact with them throughout Florida. And those are the contact points for them.
Doctor, I have a brief question. I want to give your phone number again. It's 954-455-9404. You're in the beautiful city of Hallandale Beach. I know the chief of police out there, Sonia Quinones. Shout out to her. I would have to ask you this question because a lot of the people in my family are practicing this. Very quickly, if you could give us an answer. Grounding, walking barefooted. I see that a lot of my family members do that. What do you say about that?
Yeah, so walking barefooted, it's a no-no, but also you have to pay attention what kind of shoes are you wearing and what kind of arch supports, especially if you're a diabetic. You don't want to walk barefoot. That's number one. And number two, you have to make sure that the shoes fit you correctly. They're not too tight, that you wear the diabetic inserts. And for the non-diabetic patients, we have what it's called orthotics, which are inserts that we put in the shoe. It can be custom or it can be prefabricated. And those help with pain in your feet, also with your knees, with your back. Like mainly what they do, they align your body. So it takes pain away from different places within your body.
That's good information. I really appreciate that. Thank you. And again, your phone number is 954-455-9404. You're located in Hallandale Beach. Do you have any parting words, Robert?
Absolutely. For those of you that are just joining us or cannot remember the good doctor's name, which is up on the screen.
Strambu, Adriana Strambu.
She is a physician, a podiatrist, the foot doctor. But listen, I know that you mentioned to me that you're very civically engaged and you want to do an event in the near future. I would like 2 things from you. One, more information so we can share that event and make sure that it is a success, because I think that what you guys do, providing care pro bono to the community, is incredibly needed.
We're going to put our information on our website.
Yeah. The other thing that I was going to ask for was those tips and those advice we like to keep you in the mix of what we're doing, right? Get you involved in the family inclusion of to be able to provide information. We have a resource page on our website, miamicoptalk.com, which we'd like to add those tips and some reference points. Can you help us get that information consolidated and get it up on the website?
That would be great. So can I tell you like in a minute, summary of what we're planning to do? So
Sure.
what we're trying to do with the public affair with the association, we really want to take care of the underserved and people who cannot afford and make a diabetic awareness. April, actually, it's Foot Health Awareness Month.
Wow.
And we would like to donate some socks to those people who cannot afford, like clinics, maybe like Camila's House or any of these clinics that have people who can take advantage of this socks. And we want to do that throughout the state. And we're going to have a shipment in Orlando, one in Tampa, and one here in Miami.
We're going to put your information on our website. That's miamicoptalk.com. We're going to put your information on there, and we're going to hopefully collaborate with you more.
Get on a podcast. Let's
and we'll maybe get you on one of our podcasts so we can speak to the community. People don't realize how important being on your feet is. Especially healthy feet. Yeah. It's an important thing.
Walk away from
I appreciate the fact that Robert gives me a foot massage every time we start the show, right before we start the show.
Oh, yeah.
But it's not the same thing.
It's not the
same thing. We definitely need to have medical attention provided to every area of our body, including our feet. Very important. We spend our whole life on our feet, in one way or another. So our shoes are very important. I'm sure you give advice to people on what kind of shoes based on the activities that they conduct in their daily lives. So we're going to put your information on our website, miamicoptalk.com. And as we close out the show, Robert, you got some parting words for the good doctor in our community?
Just doctor, we love to continue the conversation, collaboration, look forward to helping people. And think about this. Here you have the medical community providing a service free of charge in this project that they're about to embark on to people in need. And often police officers are called to events or scenes because people have needs, unmet needs. So we're building this bridge of community supporters, stakeholders to be able to better help the community and announce the great work that they're doing. Doctor, I can't thank you enough. I hope you, the baby, and the family are doing well.
Thank you so much.
Look forward to speaking with you in the next couple days on our podcast, miamicoptalk.com.
Thank you for having me.
All righty. And as we get ready to close out, last shout out to our community sponsors, Miami Tactical, Mainland Marlins, Share Your Heart, New Orleans, Mainland Marlins podcast every day, 15 minutes in the morning. On Wednesdays, Tommy, what's the time?
2 or 3 o'clock.
2 or 3 o'clock. He knows what he's talking about. Mainland Marlins. Go visit him on Facebook, Mainland Marlins. And some of the players should listen in also. They can get some good tips.
Has the team put you on payroll?
No, not yet.
Yeah. All right. So thank you for joining us in another episode of Miami Cop Talk. Visit our website, miamicoptalk.com. Robert?
Join us.